Hi everybody, so we're here at the Neo Medicine Institute again. Today we're introducing Fiorella Bianchi, a good friend. She's a licensed clinical social worker and also co-founder of Live Light Unlimited, right?
Co-partner, but yeah, close.
There you go.
So just before we start, I do want to clarify, because I know a lot of the questions that come around is, why not a psychologist, why not a psychiatrist when doing a ketamine-assisted therapy? And the truth is that licensed clinical social workers are also trained in clinical settings to provide therapy in that sense. So we go through all of the trainings that have to do with therapy. The difference is that our approach comes from person and environment. So we take into consideration where that person is located, their background. We take kind of like a psychologist, but it's just more focused than that. So I just wanted to highlight that because I know that's a huge question.
I know, I had that question and Dr. Liliana clarified for me, but thank you for clarifying that because I think it's very important as well. Today we want to talk about at-home ketamine.
Yes, at-home ketamine kits, absolutely.
Right? This is something that we see more and more, right?
Yeah, it's becoming more adverse. It's becoming more easy to get. You go online, you find, a medical provider that you just have to fill out a form, you say a couple questions, you don't really have that face-to-face interaction, but you do have like a telehealth kind of situation. Right. And they send you the ketamine through mail. Right. And so you take it at home and you go through your trip at home and then eventually you do a telehealth session. But the question,
or you get sent a questionnaire. I've heard both. I mean,
right.
You get sent a questionnaire after, or some questions, how you're feeling today, right. Sad, this, so you answer that. So we wanted to talk about the risks of that, right?
Right.
We've seen certain patients, one, not get the dose that they're supposed to be getting, either too low or too high, and two, having side effects and unwanted side effects related to that, maybe having bad reactions to it, and not doing it in a safe manner.
Or misusing of the drug.
Completely.
Where they take one pill and they say, oh, I don't feel anything, and take another one. And
or using it recreationally as well.
Or using it recreationally.
Which, ketamine is very safe, and when we use it in a clinical setting, we haven't seen any patient develop any addiction. That's something that is very important to clarify. So we don't have patients coming back and saying, I want more ketamine. No, that doesn't happen.
It's a controlled space. You're capable of managing what's happening and you're observing the situation.
And the dosages that we use are clinically proven to be safe, right. And to also give you the results without having any side effects. Right. That's one of the most important things. I think it normalizes ketamine, and it creates a sense of availability that we shouldn't. Has the potential for abuse? Yes. I mean, it's something that has been abused, just like other medications.
Too much of anything will be considered abuse.
Completely. And without the right guidance. That's the thing.
Go ahead.
No, and we know, I was going to touch that, we know that there's 3 factors that affect the results with ketamine. If you're looking to get the right results with ketamine, you need to look at the mindset, which we do with the psychotherapy component, the setting, which we do in a controlled environment, and also the dosage.
Right.
Those 3 factors are going to affect your results and how much you get out of ketamine experiences.
Right. If you're a patient or a client that is struggling with trauma and they live in the environment, maybe it's childhood trauma, and they come back home and they're struggling with that depression and they're taking this ketamine in the home that is creating the trauma, the anxiety, the sadness, it's not going to be a good trip. And if you don't have someone to guide you through that, if you don't have someone to give you the tools to kind of cope with it, you're going to go into a downward spiral.
Right. Or feel safe, like you mentioned.
Right.
And that's why the clinical setting, the right dosage is important. I do believe that there's, some benefits to the at-home ketamine.
I think the exposure is what's really great.
Yeah.
Because of the fact that, I did hear that you were talking about the horse tranquilizer. So I think it's great that we're having this conversation now about ketamine and how you can use it in a more beneficial and holistic approach rather than just as a party drug.
Right.
And the exposure is important. So people aren't afraid to talk about it and to talk about what's going on in their life. But now, how much is too much?
Completely. So there you have it, guys. If you guys have any more questions, please send them our way. We'll be happy to answer your questions, and we look forward to talking to you in the future. Good luck.